Hi friends, I'm Dr. Mohammed. Thanks for watching. Now let's talk about Sulvorid Tablet uses, side effects and price in Pakistan. Sulvorid Tablet is an FDA-approved antipsychotic medicine. It contains Levosulpiride as an active ingredient. Sulvorid 25 mg treats acute and chronic psychotic illnesses such as schizophrenia, depression, anxiety, hallucination, and vertigo. Also known as a tranquilizer, Sulvorid is also indicated for treatment of GERD. Sulvorid contains levosulpiride, which is a selective dopamine receptor antagonist. It imparts its antipsychotic effects by selectively blocking the D2 and D3 receptors in the brain and the periphery. In the gastrointestinal system, this effect increases the tone of the muscles to impart the intended effects. The Sulvorid tablet price in Pakistan ranges between 11 and 14 rupees per tablet. The price can vary depending on the manufacturer and the strength of the medicine. Sulvorid tablet uses include schizophrenia. Sulvorid is primarily used to treat symptoms of schizophrenia. Levosulpiride helps reduce hallucinations, delusions, and other cognitive difficulties associated with this condition. Vertigo, Sulvorid 25 mg can help treat vertigo, during which it feels like you or your surroundings are spinning or moving when neither is moving. Some studies suggest that Sulvorid might help manage vertigo, possibly due to its dopaminergic modulating effects. Sulvorid may be used to manage anxiety symptoms. The mechanism involves the modulation of certain neurotransmitters in the brain, which helps alleviate feelings of unease, nervousness, or worry. It's important to note that it's not a first-line treatment for anxiety and is usually reserved for cases when conventional anxiolytic therapy fails. It is also a sleeping pill as it reduces anxiety and induces sleep. Depression, while Sulvorid 25 mg primarily targets psychotic symptoms, it can sometimes be used as an adjunct treatment in depression, especially when other antidepressants are ineffective. Levosulpiride can balance certain neurotransmitters levels in the brain, potentially aiding in mood stabilization. Gastroesophageal reflux disease. GERD occurs when stomach acid frequently flows back into the tube connecting the mouth and stomach. Sulvorid might help in this condition by promoting gastric emptying and thus reducing the chances of acid reflux. Delayed gastric emptying. This condition, also known as gastroparesis, results in slow emptying of food from the stomach. Sulvorid can stimulate gastric motility, aiding in faster emptying of the stomach contents. Premature ejaculation. Levosulpiride is used in managing premature ejaculation, although it's not a primary indication of the drug. So how do we take Sulvorid? The instructions for taking Sulvorid tablet include: follow the prescribed dosing schedule and the dose of the medicine. Swallow the tablet with a glass of water. Do not crush or break the tablet. Sulvorid 25 mg and Sulvorid 50 mg are available in the market. Take the prescribed strength based on your condition. Take the medicine at the same time daily for optimum benefits. Avoid altering the dosage of the medicine without a doctor's advice. Do not discontinue antipsychotics like Sulvorid 25 mg as they may cause withdrawal symptoms. Some of the reported side effects of Sulvorid tablet include headache, drowsiness, irregular menstruation, fever, gynecomastia, weight gain, constipation, fever, irregular heart rate, low sexual drive. Sulvorid tablet is categorized under pregnancy category D and is unsafe until absolute necessity is established. This medicine has been reported to harm the developing fetus and the mother, especially during the second and third trimesters. Sulvorid alters prolactin levels and milk secretion, therefore it is avoided during breastfeeding. Consult a gynecologist before using Sulvorid during pregnancy and lactation. A dosage adjustment is required for levosulpiride in patients with liver failure. The drug is mainly metabolized by the liver, therefore careful monitoring is required in patients with hepatic impairment. Sulvorid causes drowsiness, especially after dosage adjustments. Therefore, avoid driving, swimming, and other such activities that can increase the chances of accidents. Levosulpiride treats GERD by increasing the pressure of the inferior esophageal sphincter. This prevents the backflow of acids from the stomach to the mouth. I hope you liked the video. Like and share our channel. Subscribe to our channel. Thank you.